Good day. We are the student nurses of Group 1 of BSN-3G from the University of St. LaSalle College of Nursing. I am Student Nurse Alvaran, together with Student Nurses Bailon, Birondo, Bolo, Burgos, Calamay, Cadlas, Castro, and De Los Reyes. We are going to present to you our nursing case study about bipolar disorder. This case would create a learning opportunity for us to have a deeper understanding of the significance of knowing how to apply the appropriate for nursing concepts and safe nursing actions holistically and comprehensively, and formulate the best plan of care to address the needs, problems, and issues of a client with bipolar disorder. Lastly, the group chose this case as it calls for effective and therapeutic communication, which the student nurses could give a spark of change to the life of a client with bipolar disorder.
Bipolar disorder is a mental health condition that affects a person's day-to-day interactions, behaviors, mood, thoughts, energy, and ability to focus. There are 3 different types of bipolar disorder: bipolar 1 disorder, bipolar 2 disorder, and cyclothymic disorder or cyclothymia. All 3 types cause symptoms of either mania or depression, or both. Some examples of manic symptoms are unusually high energy, talkativeness, distractibility, and less need for sleep. Some examples of depressive symptoms are feelings of extreme sadness, lack of energy, lack of emotions or motivation, hopelessness, and guilt. The difference between each type of bipolar disorder comes down to when they begin and how severe the manic and depressive symptoms are. Bipolar 1 disorder typically begins around age 18, although onset can occur at any point in someone's life. A person with bipolar 1 disorder will experience manic episodes that are present for at least 7 days and can be so severe that the person may require hospitalization. The person may also experience major depressive episodes or symptoms, although some people with bipolar 1 may only experience mania without any depression. A person with bipolar 2 disorder will experience episodes of both major depression and hypomania. The symptoms of hypomania are the same as mania, but they are less severe and only last up to 4 days rather than a week. Cyclothymia can begin as early as 6 years of age and may eventually develop into bipolar 1 or 2. A person with cyclothymic disorder will experience hypomanic and depressive symptoms, but never to the extent that they qualify as mania or major depression. There is no single cause of bipolar disorder, but research shows that it may be related to several factors, such as genetics, a person's environment, and brain structure. It is common for people with bipolar disorder to have other mental health diagnoses, such as psychosis, anxiety disorders, eating disorders, or substance or alcohol use disorder. Bipolar disorder is a lifelong mental health condition, but with the help of treatment provided by a licensed mental health professional, it is possible to reduce and manage the symptoms. Bipolar disorder is usually treated with a combination of medication and psychotherapy.
For the patient's baseline data, the name of the patient is BA. She is 20 years old, female, from Barangay Handumanan, Bacolod City. She is single, born on January 15, 2002. She has 3 siblings, which are all males, no number of dependents or children. She is a Roman Catholic with the highest educational attainment of a high school graduate. She has no occupation prior to admission, and the next of kin is her mother. The date of admission is on December 13, 2021, with the date of care of July 5, 2022. Under the service of Dr. Arcajada and Dr. Viñas, the medical diagnosis is bipolar manic disorder with chief complaints of behavioral change.
History of present illness. The client stated that according to her mother, she was always in a drinking spree with her friends, missed her meals, and went home early in the morning. Before being admitted to BCMHCC, she was first admitted to CLMMRH because she does not eat her meals. General appearance and behavior. Client BA is appropriately dressed during the entire exposure. She is well-groomed, she always crosses her legs, puts on makeup, and she sometimes slouches during our conversation and sways her feet. She has a tattoo on her finger spelled out JOSA. Sometimes her face remains stoic if there is no interactions with her, but she smiles and laughs a lot during conversation. She is hyperactive and participates in every and any activity with no hesitation.
Behavior. The client was excited, talkative, and open to answering questions. She answers immediately and talks rapidly most of the time. She has a well-modulated tone and volume, although her articulation is not good sometimes. Often she jumps from one topic to another. Stuttering and repetition of words were also noted. Mood and affect. During the NPI, she was energetic, making various gestures, standing or walking from one place to another. The client has a labile personality, and she is overly happy and energetic most of the time. Form of thought. The client claims that she has no obsessions, no intrusive thoughts or images in her mind, and no irrational or excessive fears. However, it is notable that the client perceives herself as a bad person.
Client is oriented in the time, place, person, and situation she is in. She was able to recite the alphabet with only little confusion between the letters B and D, recall some nursery rhymes, recall happy memories with family and friends, and recall what happened in the past 24 hours. She was also able to recite numbers 1 to 20 accurately and without hesitations. However, she struggled with counting backwards. She can do addition but only up to 2-digit numbers and struggles with multiplying and dividing. Based on Khan's 10 questions, it was identified by the student nurse that the client has no organic brain syndrome.
For the insight and judgment, the client claims that her bad habits and vices are to blame for her illness. She claimed that she enjoyed too much and had forgotten about the consequences if she continued to disregard herself mentally and physically. She was aware of her illness after admission because it was explained to her by her mother. And when she was asked if she were given a second chance at life, she replied that she would live this life happily and healthily. For the reliability based on the student nurse's perception about the client, the gathered data and included in this documentation is more or less 50% reliable. The student nurses were able to interact with client BA in a face-to-face exposure and assess some aspects of her health, such as her appearance, behaviors, and communication. However, much remains to be uncovered about her personal history and health history, which may contain significant information for a more comprehensive MSE, due to the constraints in time. One of the limitations as well is the lack of subjective data from her family and healthcare providers' accounts.
Ngayong hapon, ako gali si Jen, 3rd year college, din sa USLS, kag ako ang imong student nurse subong. Ano nga imong pangalan?
Maayong hapon, nurse. Ang hapon naman niya pangalan si Bea.
Kami gali ang mga student nurses nga ready subong para maghatag activity sa inyo para sining adlaw. Subong mastorya ko anay sa imo kag may mga pungkot ko, okay lang sa imo.
Ay, mayogit. Okay, malang sa akon kung may ara ka mangkot.
Di kamusta man ni imo kumatsyag?
Ayaw, man ako pamatsyag subong tawhay lang.
Di pila na gani imo edad?
20 years old ako.
San oy imo nga birthday?
January 15, 2002.
Ti ano ka na diya kadugay sa Bacolod City Mental Health Center?
6 months na ko di.
Ti sino nagdala di sa imo ya?
Akon mama, nagdala di sa akon.
Sa din kagani dahil gay star?
Nagahandumanan ko.
Sino man mga upod mo sa una, sinyo balay?
Akon mama, kagisa ako ka-utod na lalaki.
Ti may utod kagali, babae or lalaki siya?
Oo, may utod ko, 3 ka lalaki, isa pulis. Tanan may pamilya na ako pinakamangkod sa akon.
So damo ka mo gali?
Oo, nurse.
Ati, be, Mira, kapag gusto mo uno kung istoryahan para mag-anyo, kumatsyag?
Wala naman, nurse. Gusto ko na lang magpahuway kung magpungko-pungko naman. Salamat din sa pagbulig sa akon.
Ate, sige, be, may ari ko tani pamangkot kung ano ang rason nga ari ko di subong. Okay lang kung istoryahan mo sa akon ang rason.
Abaloman ko kay hambas ako ni mama. Wala ko kanugakaon. Dayon, nasi ko ma-eritar kag maaki.
Ate, isang san o paninga dasid ka ma-eritar?
Dubai na hambal nila na kuno sa tatay ko.
Gano'n ka lang kung kaagahon ka nagapuli.
Talaga ako sa bread ko kaysa dindiin day. Miski diin ako ka pangalabot.
Ate, anong mga ginahambal sa mga barkada mo kung mag-aga na ka magpuli ka kakigan ka?
Lain, at least ginahagad ako inom. Ginahagad ako nga malakat kami mga awambo na.
Ate, na-notice ko, Blado ka namin isang mood mo subunghaw. Excited ka na para sa aton activity?
Oo, excited naman ko.
Ate, enjoy ka man kagina sa hataw, yabe? Mian ka man?
Nag-enjoy man ko sa hataw, nasadyahan man ko.
Ate, ato yung sa kabalo kaya mag-weaving, bay?
Oo, kabalo ko na eh.
Wow, kanami isang imong obra kag sang design, bay. Pero sino ni siya si Junjun? Nga abe ya, love Junjun, ha?
Crush ko ni nga guard, gisabat din ako sa core. Pagkita ko ni siya, obra ako, obra.
Ate, nanamian ka man niya sang obra mo? Nalingaw ka man?
Oo, namian ko kay may butterfly ako design, kag lagi ng utok na ako mag-obra.
Ate, taguon mo ginibay ha? Butangan mo ni isang imo nga mga personal na gamit, ha?
Oo, butangan ko niya ako makeup.
Kag wow ka namin, gilas ang imo nga dress ba? Tebe, last na nga adlaw subong nga kami imo student nurse. Ano ang nabatsagan mo?
Subuan ko, di nakamuli kakadto.
Ano nabatsagan mo sa culminating activity ta? Nalipay ka man?
Nalipay, gid po kay nami ang inyong mga prizes na ginhatag kag participate kita nan.
Amon niya mga games siya, okay man?
Nami, pa ninyo ang mga games.
Be, halong ulit permi ha. Thank you gid sa imong oras nga ginhatag kag sa kooperasyon.
Thank you man. Kaso naman, happy gid ko. Good luck sa inyong profession. Bye-bye!
From 1 to 3 years old, her anamnesis are documented as follows. Psychosexual to anal stage, she did not encounter any difficulty with bladder and bowel control. BA stopped using diapers at 2 years old. Psychosocial, autonomy versus shame or doubt. BA had autonomy during her younger years from arranging her toys and choosing her own clothes. Interpersonal, delayed gratification. BA was told to arrange her toys after playing so she can play with them again the next day. Anamnesis, client BA was guided by her mother to help her develop self-discipline, self-reliance, and autonomy. For 3 to 6 years old, we have psychosexual phallic stage. This is a time where her father died and her mother gave more attention to BA compared to her siblings. She looked up to her father as he was symbolized as the protector of the family. Psychosocial initiative versus guilt. She was energetic and playful at these ages. She had a hard time coping after her father died, although still manages to play with her friends. She often follows their rules because she fears that she would be left out. Interpersonal formation of peer group. Client BA spent most of her time afternoon playing with her friends and developing a speech containing vulgar words. Her mother verbalized that she follows what her friends have said when playing. Anamnesis, BA's mother gave the client freedom to explore and enjoy her childhood, although she notices that she was slightly bossy around towards her friends when playing and she prefers to play with boys than girls. When someone distracts her or she is unable to complete a task while playing, she is very patient and tries again. For the next set of anamnesis, ages 6 to 13 years old, puberty, psychosexual latency stage, BA spends most of her time playing with her friends and taking a nap in the afternoon. She seldomly plays with her siblings. Psychosocial, industry versus inferiority, she finds playing board games and drama interesting and fun. She finds it easy to win against her peers. Interpersonal, developing relationships with the same gender. BA has a best friend growing up. Anamnesis, client BA was already hyperactive and bossy during this stage and always tells her mother that she can do such things competently, just to prove that she is confident and strong on her own. 13 to 21 years old, puberty to adult, we have psychosexual genital stage. Client BA was able to identify her sexuality and was able to express feelings of intimacy, attraction, and affection for others. Psychosocial, identity versus role confusion. Client BA experienced unusual talkativeness and racing thoughts. She experienced insomnia, made irrational decisions, feeling invincible while acting impulsively and easily agitated. Interpersonal opposite sex relationship. Client BA did not mention any relationship with the opposite sex. Anamnesis, client BA developed a sense of sexual identity. Although growing up without a father, she does not get nervous nor is self-conscious talking to men who she does not know very well. She also started drinking and smoking at this age and started to experience extreme mood swings which manifest symptoms of the manic phase of bipolar disorder. The anamnesis describes the medical history of the patient with implementation of the different theories which are Freud's psychosexual theory, Erickson's psychosocial theory, and Stack-Sullivan's interpersonal theory. From birth to 1 year old, we have psychosexual oral stage. This talks about how BA likes to suck her thumbs during infancy and put toys and food in her mouth. Psychosocial, trust versus mistrust. This talks about how BA preferred to stay with her mother's side as she feels safer around her mother. Interpersonal, gratification of needs. BA has everything she needed as she grew up. For the anamnesis, BA mentioned that her mother is her primary source of care. Her mother took good care of her as she grew up. Her mother was very religious with the prenatal checkups and consultations, which led to her normal, spontaneous vaginal delivery.